I've logged into your portal and you filled actually a consent form out perfectly. I went through it this morning and I just wanted to ask you if you had any questions when it comes to your consent.
No, not really.
Yeah. So you've gone through sort of your healthcare. There's nothing here that I was worried about in terms of your medical history. We went through your surgery consent. So today we're going to transplant approximately 1,300 grafts from the back and the sides of your scalp into your hairline and use the FUE or follicular unit excision technique. And that involves us taking each hair individually out from the back and the sides, re-implanting it back into your hairline. You'll be left with very, very, very small pinpoint scars, Lee, where you've had those hairs taken out.
Okay.
And then those hairs go back into your hairline. I'm going to implant them so they go in the natural direction and natural angle of your existing hair. To perform your surgery, I need to numb the back and the sides of your head with local anaesthesia, similar to the substance that they use in dental surgeries to numb your teeth. Have you had those things before?
Not really.
Not really.
Yeah.
It's a very safe medication. The risks were all there when you read through them. Did you have any concerns with the risks or any questions?
No.
So the key thing is we're going to do some injections across the front and across the back of your head. Once those injections are done, you should not feel any pain whatsoever. Yeah. If you do, you've got to let me know. You'll feel touch and pressure, but pinprick sensation, little pain sensation, you should not feel, and you must just speak to me if you're feeling any discomfort. All right?
Okay.
If you don't, what will happen is your body will become more uncomfortable, you'll bleed a bit more, you make my life a lot more difficult. So just let me know. You should not feel pain.
Okay.
All right?
All right.
The other risks of surgery, they were all listed here. Did you have any questions when it came to the risks?
No, probably just one thing that I did mention about the redness that actually occurred a week ago, and then I used the medicated shampoo.
Yeah.
I think it's better now. So is that a concern to you?
No, not at all. I remember you sending me an email about it actually, yeah, and there wasn't any worry from my end. Your scalp looks really good, really, really nice and healthy. I haven't got any concerns about that redness going to be affecting surgery, and actually there's no signs of it, so that shampoo has worked really, really well pre-operatively, so well done with that. But you will get a mild amount of redness across your hairline. That's normal after surgery, and then that will fade as the weeks go on, and then it will go to normal skin colour eventually.
Okay.
All right. Let me know if you have any issues after surgery with that.
Okay.
The last bit of the consent was around extra grafts. So if we go above 1,400 grafts, it's just asking your permission for that. You don't pay anything extra for it. So it's just making sure that you're comfortable with that. Is that okay? Yeah, makes sense if you're getting surgery. We're going to implant your hair across your hairline in a subtly staggered manner to introduce those irregularities into your hairline. That's done intentionally for you to get a natural looking hairline. So don't worry about those indentations and irregularities. That's done purposely for you to get a far better, more natural looking hairline. Yep. When I draw your hairline this morning, we're going to draw it similar to what we drew before, but it's going to be a lot more exact. You will have final sign off on it. If you've got any worries, any concerns with the hairline, you must let me know.
Okay.
Yeah? And I'll talk you through your hairline and how it's going to look and what the considerations you need to think about. Yeah. And that is it. Photographs. I've said that you've consented for photographs and for filming for today's surgery as well. Are you still comfortable with that? Yeah? Perfect. Any questions with any of that consent? So it will be used for social media and for our website primarily. That is it. Yeah? Comfortable with that?
Yeah.
Okay. That's everything. So just for our viewers, that was just me and myself, Lee and myself going through Lee's consent form. Every patient gets access to an online portal where they have all their consent forms, all their documents stored in their specific location where they can log in, see their appointments, and see their forms that need to be filled in, and also their aftercare instructions, which include this booklet for patients that takes them through every single day after surgery with bespoke instructions and diagrams on how they're going to recover. But that portal includes all those things, including those instructions.
And they have that sent to them in advance of the...
Yeah. All patients have access to their consent form and portal in advance of the surgery, so they have ample time to go through their consent, make sure they're making an informed decision. That's really important in our clinic. We don't want patients rushed into signing something for surgery really quickly without having due diligence and ensuring that they're making their decisions in advance of the surgery day. So we have a very sophisticated online system that myself and Dr. Fernando have curated over years to ensure patients are having that digitized system that's available at their fingertips at home. Yeah. Right, we're going to now start to draw your hairline, Lee.
Really nice, strong definition to his temporal points.
Yeah, it does.
Yeah, really nice.
Yeah, doesn't really work there. It's just literally across the hairline. If you raise your eyebrows, Lee, and relax, raise them again. And relax. Raise them again as high as you can go. Thanks, that's perfect. And relax. We use a little eyeliner to draw somebody's hairline.
And you use a white China marker?
Yep.
Yeah.
Signature of our clinic.
Yeah.
It could be purple, we chose white. Now, the reason why we use eyeliner is just because we want to sketch their line in and make minor adjustments till we get to the most balanced looking hairline for a patient. We don't want to draw it in pen because it's difficult to make adjustments afterwards. We used to draw it in a brown ink and that never worked in my skin type. White works for every single skin type, no matter where patients are from in the world. So it's used as default. That wasn't my thinking, that was Dr. Fernando's thinking. He's a far smarter man than I am. Right, head up for me. What do you got planned the next few days, Lee?
Stay at home.
Yeah. So you've got 2 weeks to recover and to get back to sort of normal looking. That's plenty of time, really, after surgery.
2 weeks is a lovely amount of time
Yeah.
to have off,
Yeah. All right.
So when you're designing a hairline, is there a certain feel that you have for patients when you look at their head shape and their bone structure? And
When you're designing someone's hairline, you have to take into so many different accounts where their original hairline was. You can tell that from generally their musculature and their bony structure in their scalp. And you can also look at old pictures, but generally people will age and their hairline will change as they age and as they mature. So the first thing is looking at that original hairline, understanding how much hair loss they have at present, understanding their donor area capacity, so understanding how much hair you can actually transplant across their lifetime. If you draw a hairline that's too low and they don't have too much capacity, going for that hairline is going to give the patient a lot more issues as they grow older, and then they need more surgeries to keep up with that really low hairline. So it's about understanding what capacity they have and actually adjusting the line accordingly for the future. And then when it comes to drawing the line, taking into account natural ethnic differences is important. So Lee, being from East Asia, generally have a flatter looking hairline than if you were to take my ethnicity or a white Western Caucasian ethnicity as well. So I'm having to draw his hairline accordingly to ensure that those ethnic principles are adhered to. I then add subtle contouring and make sure it hits the temporal angles on both sides in a natural manner. This line right now is quite rough, but I'm going to start etching it and making it closer and closer to the more balanced looking position. You also want to ensure the most central part of the hairline is the lowest part, so I just take the central marker for his hairline and I mark that, ensuring that no part of the line goes lower than that position too. And then it's about getting to the position of a line that suits the patient aesthetically and what suits them and what they want to achieve. So I'm getting closer and closer to that position now.
with Lee, he's not experiencing any hair loss further than just in the hairline in the frontal area?
Correct,
Okay.
correct, yeah. So we're just tackling his hairline and his temples today. We're not doing any further work anywhere else.
So that allows you at this point with quite confidence to be able to build a relatively strong hairline shape for them.
Correct, yeah, absolutely. And today's procedure isn't a large procedure by any stretch of the term. It's quite a mild to moderate size procedure, so we're leaving plenty of donor area for the future in case he needed to have more surgery again.
Is the plan to shave both the recipient and the donor area?
Plan is to do minimal shave procedure.
Okay.
So what we're going to do, we're going to shave very subtly into Lee's hairline, and then we're going to do a short haircut across the back and the sides to facilitate donor area extraction. Going to keep most of the hair long on top, so that Lee can comb it over his hairline and conceal it so that he can go back to work quicker. Right, Lee, we are done. Any questions with that line, Lee?
So just now you mentioned about the irregularity, so that will be actually do it, how will you do it?
So we will, for example, if this was your line, what we would do is we would go slightly irregular across your line.
Okay.
So whilst this is a white solid line, actually when it comes to the implantation of your hair and I'm making incisions, I'll make gradual indentations across your line.
You're currently just marking out how far back you would need to
Operate, operate and shave, So we're just going to operate as deep as that and shave as deep as that. And then we're going to operate obviously to the white line and a bit beyond it. Bring your chin towards your chest for me. Excellent, that's fine, that's good. Just going to draw the donor area. You'll feel the pen across the sides of your scalp, okay? All right, Lee, I'm going to do injections now. You're going to feel some sharpness just here. And then we're going to work around the sides and the back, and then across the top. It'll feel most painful behind your ears and then the base of your neck. Once you get past that, you'll feel a lot more comfortable. I want you to take deep breaths, relax to the music, use that stress ball, and in about 4 minutes time, it will be done, okay? First injection coming up in 3, 2, 1. Almost done, Lee, well done. Well, I'm going to just check and make sure you're numbing all the areas. What I want you to do is give me scores out of 10, depending on how much pain you're feeling, okay? If you feel no pain, just say 0. If you feel touch and pressure like this, say 0. If there's any pinprick sensation, you must let me know, okay? All right, we're going to start here. Any pain?
2,
Here?
1,
Here?
0.
If you feel any more pain, please let me know. So what I'm doing right now is I'm just taking a few test hairs from Lee's donor zone to see how long they are and their morphology of the grafts. So I can measure them and I can create the appropriate environment for them in his hairline. His hairs are coming out really nicely. They're typically East Asian in terms of the type of their hair, so it's very straight and long.
So they are long grafts then? They look long,
generally, East Asian hair type tends to be about 6 millimeters in length.
Okay.
Yeah. And Kai's is just touching 6 millimeters, so I'll need to cut to that depth in his hairline to ensure that hairs that are placed there are not placed too shallow. And likewise, you want to cut too deep because then you can start to increase the risk of complications from surgery as well. He's got lovely hair type.
Excellent. So just pulling out the grafts now.
Yeah. So ensuring when you're pulling out the grafts to minimise the trauma that those hairs go through. You don't want to tug too strongly, you don't want to damage those grafts when they come out. You want to try to treat them as fragile as possible. Using my magnification loupes, I'm able to see exactly the health to a high level when I'm taking them out, and then measuring them with a little sterile ruler to ensure that I know their length. And most of the hairs are coming out in really nice, healthy bundle sizes, which we will take a closer look when we start taking them out en masse in about an hour and an hour's time or so. Lee, your hair is amazing. It's really nice quality hair. What I've done is just taken about 14 grafts from the back of your head just to see what they look like. And I know that. We're going to get you up onto your back, and we're going to finish the anaesthesia across your hairline, and then we're going to make all the incisions across your hairline, okay? If you sit up for me, please.
Because at the moment you're removing the grafts that have already been scored or cut from the skin.
Correct.
And now you're making that excision.
Yes, I'm scoring around each hair follicle, so I'm actually punching each follicle out. Now, this step it determines a lot about how someone's outcome will be, how good and natural it will be, because you want to get good quality hairs out. Having good quality equipment is important for this step. I'm using the Wow Duo device and their punch to extract hairs. I'm controlling the punch for its depth, its speed, its angle of cutting to ensure that I'm minimizing the trauma to each graft, and also ensuring that each graft comes out at its highest quality.
It seems like such a gentle little touch that you're doing into the skin there.
Yeah. So right now I'm cutting to about 3 millimeters.
Right.
That helps to release these follicles from its anchoring structures. Sometimes patients need to have a bit of a deeper cut. Some patients need to have a shallower cut. That does vary. There's no one-size-fits-all approach with that. But yeah, it's very shallow cut in general. It's very rare that I need to cut deeper than 5 millimeters for patients, but occasionally that happens.
Because the risk of you going deeper is obviously then you end up with a higher transection rate.
Not always, but
No?
Sometimes, depending on the hair type. The deeper you cut, the higher risk there is to follicles being transected, either partial or total. That depends on their morphology. If they have an early splay, for example, that is a higher risk than if they have a late splay.
And are you able to just talk us through how Lee's hairs are?
Yeah, they're lovely. They're very typically East Asian, so they're quite straight, grow in bundles of sort of 2 and 3 units. There is a subtle early splay, especially on the sides of his scalp, so I have to navigate that with my punching. But yeah, that's really nice quality hair for surgery. I've scored the grafts out of the scalp, and now I'm plucking them out with tweezers. You will see this is Lee's hair follicles, up nice and close. That's a bundle of 3 follicular units. And I have to cut to a certain depth to ensure they come out safely and to high quality. And that depends on so many different factors. Some patients will have quite long and short hairs, and they're anchored down to their scalp in different ways, more strongly than others. And ensuring you cut to a good depth so that you release the hair follicle from the anchoring structure, so allowing you to pluck out the hair like I'm doing, is important. And it's always a seesaw balance to get the depth of the cut enough to extract your hair follicle, but without damaging the hair follicle
Because otherwise,
itself.
if you don't go deep enough, then you're struggling to pull them out then
Exactly.
with the forceps. Yeah.
Exactly. Yeah. Spot on.
And that puts more trauma on the grafts.
Correct. Correct.
And in terms of Lee's own makeup, you mentioned before that there might be a higher percentage of more twos. How's that been in terms of the grafts you're extracting?
So far, definitely more proportion of twos. That's quite typical for his ethnicity. But there is certainly a good few number of threes coming out as well, and some fours. Okay. But purely from an ethnicity point of view, we're expecting more twos. But we'll see what we get.
At this point, you're only extracting from the sides, though, aren't you? So
correct.
Typically, they are slightly lower groupings and lower density as well, aren't they? So
correct. We want to extract from the sides. If you only concentrate the extraction at the back of the head, you'll over-harvest a patch of hair. Mm-hmm. So you want to spread the extraction, reduce the amount of visible scarring. But also, crucially, in Lee's hair ethnicity and its type, the exit angle of his donor hair is a bit more at an eye line, so it's not going sort of growing down towards the floor. It almost points towards someone's eye line when they look at the back of his head. So ensuring that you spread the extraction is really important, otherwise you'll see through those hairs and onto the scars even more easier in Chinese and those type of ethnicities, Southeast Asia hair types.
So his hair grows out more to the sides then, doesn't it?
Yeah,
so
yeah.
Like a right angle.
Exactly, precisely, yeah. Okay. So spreading the extraction in those cases is even more important to ensure you are minimising the signs of visible scarring.
Mm-hmm. This is a 3 hair.
It's a 3 hair follicle, yeah, with the grey hair next to it in the middle.
Oh, so that's the grey hair then, that's why it's not quite as pronounced.
Coloured, yeah, exactly, yeah.
This is a close-up of the donor area extractions from the side. You can see this is using a 1mm wire punch, but that is the external measurement, so not to be confused with some other punches where they measure from the internal diameter. But you can see just how tiny those little wounds are, and these immediately afterwards as well, and they will start to close up probably by the end of the day.
They will start to close up, and they won't be fully healed entirely until about 5 days, but they heal very, very quickly. Yeah, I've seen patients at the end of the surgery, and they've come a long way of healing. Some of my patients heal very, very quickly.
Just tell us a little bit about where we are in terms of the extractions for the patients so far.
Yep. So we've cut about 419 grafts from the sides of Lee's scalp on his right side. We're now going to go across the back of the rest of his donor area here. The occipital zone is what we would call it, and then across to his left parietal zone on the left side above his ear, and take out the remaining 1,100 grafts. And right now I'm just injecting a bit of adrenaline into some of the areas just to help give me a bit more tension, or what we would call tamponade, into those areas.
Is there, I mean, in terms of the way that the grafts extract from the scalp here, is there any challenges in terms of the angles, or are they fairly straight?
Fairly straight. The subtle challenge on Lee's size was that his hairs would do the splits quite early when they were growing, and I had to navigate that. But here on the occipital zone, so right directly at the back of his head, the hairs are very closely aligned with each other when they're growing out, and actually it's a lot more straightforward for us to take his hair out from this zone.
I see you've planned for 300 singles on the board there.
Yeah.
That's typically what you would use for the immediate transition zone from the forehead into the hairline, around about 300 singles? Yeah,
I mean, it does vary between hair types to hair types. Sometimes I'll go slightly less, sometimes I'll go a bit more, depending on the extent of hair loss and their hair type. For Lee's specific case, 300 singles is a perfect amount for him to have that feathered, natural look in his hairline, and that transition zone that goes towards the thicker hair behind, that gives him the volume. So we've just finished extracting all of Lee's grafts. I've punched just above but what we're planning, just to ensure that we get to the right number, but also allows me a few extra grafts to put those final touches into his hairline. It's gone really well. Right now, Dr. Goring is just plucking out the hairs that I've cut, and Lee's feeling quite comfortable after that. Lee's gonna have his lunch. And over here, to my right, I've got my technical team who are just sorting out the grafts in the microscopes, inspecting them and sorting them according to the size. Amity's kindly put some follicles here for us to see, and you'll see how they go from follicles that are like they've got one hair, then they've got two hairs over here, and then you've got grafts with 3, 2, and 3 follicular units as well. They've got glandular structure here that sits underneath your skin, and then the hair poking out the top with the roots at the bottom. You'll see how lovely and straight they are. The hair's semi sort of tripod out as they get closer towards the base of the scalp, but really lovely healthy hairs that Lee has for his surgery. You see how Amity's very careful when she's sorting those grafts out according to their size. She's inspecting them under the microscope and just ensures that they're good enough quality for surgery. She then sorts them out according to their size into these Petri dishes, and they denominate according to the size of the grafts and the follicular units, and they also denominate each number that they count into these sheets, so we tally up everything, and everything is accounted for to the exact graft number. We then record them down onto this board, so it's all open for patients to see. Got 70 singles, 267 twos, 174 threes, total 511 in the first dish. Time out of the body was 12:30, so you want to get that back in between now and in my clinic we tend to get it back in within about 4 hours, but generally between 2 and 3 hours. So that'll go back in between 2 o'clock and 3 o'clock. That first dish is inside this fridge, which is cooled to 4.9 degrees. You'll see that 511 grafts just sitting there in that dish. That is the process of the extraction phase. We're very transparent in our clinic in terms of graft numbers. Every patient gets a detailed breakdown of the graft numbers that they've had during their course of surgery. They can look at how our team is sorting out their grafts on screen, and there's no smoke and mirrors in our clinic ultimately when it comes to these sort of things. We pride ourselves in high quality surgery that is transparent for patients, and it's testament to the work that we do here, so why not show patients what we do.
Anything in particular about this morning's extractions that stood out at all?
Not particularly. It's pretty straightforward hair extraction really. There was areas where the hair would do the splits a bit earlier, especially on the sides here. Areas where the scalp was a bit more anchored to the hair follicles, but all easily navigatable with the extraction. And actually that was pretty straightforward. So I ended up extracting about 1,600 grafts in just shy of an hour's time, which is pretty straightforward procedure and extraction really.
And just a little bit more of the grafts to be removed, and then patient's going to have lunch?
Correct, yeah. So Dr. Goring's about halfway through the plucking of the hair. Okay. And she's got another 800 to pluck, or just less than that.
Sure.
And that will allow the team just to count the remaining grafts whilst Lee is having his lunch, and then we'll have our lunch, and then we'll restart the implantation phase of Lee's surgery, where we do things a fair amount of different other clinics to ensure the grafts go through minimal amount of trauma and ensures that we implant the air according to the angle and direction in which it should be growing. All right, well done. If you feel any pain, please let me know, okay? Now's a good time for you to fall asleep if you feel like sleeping. It's all going really well. We're going to start putting your hair back into your hairline.
Additional incisions that you're making for the
I'm
extra
just going
grafts.
to make a few more. It'll make it easier for me later on. we have done all the incisions in this morning for Lee's hairline, and we've now taken out all of his grafts. We aimed to take out about 1,550. We ended up taking out 1,746, which is actually completely fine. We are going to transplant all of them into his hairline. Most of his hair came out very thick and healthy, so we had to create single hairs for him for his hairline to look natural, and that's relatively commonplace in protocol in our clinic.
So that's cutting down the 2 hair units into, or do you sort of trim a 3 down into a 2 and a 1?
We tend to change that depending on the goals for surgery and hair type, but in this case it was cutting 2s into 2 singles. Okay. Because I didn't want to create more 2s essentially, and I also wanted to maximise visual density for Lee, and those 3s are really important for that. So now those hairs are all going back into Lee's hairline. What we're doing right now is Lily, to my right hand side, is loading specifically 2 hairs, so 2 follicular graft units, into an implanter pen, which is this. She's threading it into the end of it, and then she's handing it to me, and I'm re-implanting them back into Lee's hairline, accounting for the natural angle and direction of his hair in his hairline. And you'll see that as I'm inserting it in. These implanter pens are fantastic. They basically protect the hair growth unit from the trauma of surgery, and it also allows me precise control over the implantation of the hair. All patients will have this technique when it comes to re-implanting their hair back into their hairline or their crown in our clinic. It allows us precise control over their outcomes, but also allows us to get quite nice high density, and it allows a surgeon on the scalp for the implantation of the phase of surgery as well, and allows us to direct the surgical re-implantation of hair even more precisely, which is a hallmark of our care in our clinic.
And you've got a little relay system here going on where the implanter pens are. Once the graft's been implanted, it goes back again, and then it's reloaded again. So you have how many pens at one time? 3?
Right now we have 4 out.
4 on a go. Okay.
But it varies between 4 to 8, depending on how big the case is and how big a team we have working on a case. Later on, you'll see one of my colleagues coming to my right-hand side and to my left, and all of us working together to re-implant the hair back into the scalp. And that requires a number of supportive team members to load those hairs into those implanters. So that are those relay systems. And you can see us online with a time lapse putting in close to 2,000 grafts in about an hour and a half using the same system. It requires years of experience and sort of training to be able to do that with this sort of reimplantation technique, because it's people heavy ultimately.
And currently you're implanting 2 hair grafts. They're all 2s, they're obviously just behind the hairline.
Correct.
The immediate hairline. And these were the ones that would have been first out of the
body.
The body, yeah.
Correct, yeah. These are the hairs that came out about 2 hours ago.
We're now just coming up to 2:45.
Yeah, so it's about 2 hours and 15 minutes. So they're the first hairs to go back in, and we want to get them back in within 2 to 4 hours of them being outside of the scalp. And we're putting them in just behind the single hairs that are going to go right at the front of the hairline. And we're going to work with those 2s first, then we're going to go on to the 3s and the 4s.
And you've made extra incisions, so you've increased the density as to what you originally planned.
Yep.
Because you've got extra grafts, which is great for the patient.
Yeah, correct. Yeah, so I always like doing that. It allows me to put some final paint strokes on somebody's outcome with extra density to get it to where I and they would want it to be. And by default, we would do that. So I'm going to be doing even more later on after about an hour or so, just to give it a bit more density where I think it needs.
Have you got any idea what sort of density that would be into that immediate hairline?
Yep, I'll calculate it at the end of surgery, but I think it'll be close to about 55 grafts per square centimetre. 55? Okay. Yeah, but I'll get an actual figure when I finish. It might be closer to 50 might be closer to 60.
And Lee's hair caliber, I know we did discuss that. Did you feel that was a sort of a medium, or was it slightly above average in terms of caliber?
I would say it's medium.
Okay.
And it's quite straight. We want to increase the density of implantation, primarily because of fighting against that hair skin color contrast.
Yes.
And also the straightness of his hair type. So we really want to get it to a nice density so it blends better with his existing hairline and it looks more natural.
They're going in very nicely, aren't they?
Yeah, it's a pretty straightforward implantation. We're just working across the left-hand side, just for the team. It'll make it easier for us to all work on Lee's hairline later down the line. Yeah, so there's always a method to the implantation. It's about getting his people on the scalp and ensuring those hairs go back in good time. You can see how straightforward it is.
Yeah, it's very straightforward.
Yeah.
And you know, what I can see is the density is great.
Yeah, and it will get better as I work through the hairline with more grafts and into those nooks and crannies that I want to increase density in. Lily's great at loading. It takes a long time to get to that level of skill when it comes to loading. So what you're seeing isn't commonplace. And loading it to a high standard is really important, so you're not just damaging those grafts when you're putting it into the implanter. Sometimes people will damage those hairs as they go in, and they will shear the grafts, so they'll cause fragmentation of those grafts when they put it into the implanter. So it's important you do it to a high level. It's not just about speed, it's about ensuring that those hairs are loaded safely. You will see that we're all wearing loops as well. So it just gives us better control and accuracy when we're implanting hair. We've almost completed the 3s in the first dish, and then we've done the majority of the 2s, and that's been in about 25 minutes. That's about 300 grafts, just myself alone with an implanter pen. So it shows you that, you know, it's not necessarily the slowest technique, or it's not the quickest technique. I think it's the technique that works best for us. And some clinics will work better with other methods, but we find this has worked for us really well, and it's safeguarded our patients over the long term with really nice outcomes. Yeah, I mean, you haven't seen it fully in action yet, but yeah, it's pretty good. It's well coordinated. Everybody knows what they're doing. What you'll see, David, is that we're constantly just checking how many grafts are in the dish left, so we can plan ahead in the next phase of implantation, just really accurately planning where we're placing hairs in specific regions of the scalp. So grafts are not placed in the incorrect zones or the incorrect area. We meticulously plan that, and we meticulously forecast that, and that's the surgeon's role. So you'll find that we're often dictating where the hairs are going and getting placed. We're doing singles now.
I know, it's very sedative, isn't it?
We're just putting in the final 300 now.
Okay, so final 300 grafts, and we are 20 to 5, and Dr. Vara is still making placements and a few incisions as well.
Yeah, just the final touches. Finish 3s, 2s.
Here is the haircut rooms. This is where the patients will have their haircut prior to surgery, and also a little area here for the patient to relax, have lunch, and I can see here that we have the post-op care bag ready for the patient who's about to finish surgery very, very soon, and the new, clean, unbranded baseball cap for the patient to wear when he leaves.
I'm just gonna take some pictures, and then we're gonna get you ready to go home.
Very happy with today's outcome then?
Yeah, absolutely. All 1,746 grafts have gone back into Lee's hairline, which you'll see there. These irregularities we placed across his hairline. He needed more work on his right than he has done on his left-hand side. The surgery itself has gone really smoothly. Just adjust this, it's a bit better now. White line, there you go. He's got that blue tinge across his hairline from the dye we used during surgery, but that's incredible density. We calculated it at 60 grafts per square centimetre. It's pretty high, but also necessary for Lee's hair type for him to get a better looking outcome.
Yeah, that's going to lead to an exceptional result, isn't it?
Yeah, it is, yeah.
We're really looking forward to seeing how that turns out.
Yeah, he's had amazing blood supply to his hairline across the area, which has actually boded really well for us because we've been able to push the densities better for him, and you can see blood supply is so good it's starting to ooze just through the central part of his hairline that will eventually stop in the next few minutes. All those little white areas is where we placed hair. You can see how thick and dense that is. Yeah.
So you're putting a gauze over the donor area?
Yeah, no, it's Gelinet.
Okay. And when
dressing.
when does that come off?
Tomorrow.
Tomorrow.
That's your hairline. Any questions?
No.
Not for now.
Yeah, no for now.
Yeah? Dr. Goring is going to go through all of your recovery and your aftercare.
Okay.
And so she'll answer any questions you have about at home and any issues you have at home.
Alright.
We'll give you a ring tomorrow to see how you're getting on.
Okay.
If there's any problems, just please give us a ring.
Alright.
Yeah? Okay. You should be fine then.
Okay.
It's gone really, really well.
Okay. Thank you.
Really, really well. Yeah. Very, very smooth surgery. Being very patient. I know you're feeling slightly drowsy, aren't you?
Yeah.
Yeah.
I see that long.
Yeah. Okay. Stay there. We're going to finish the bandage.